Hey, good evening everyone. Tonight I'll be telling you about how I'm playing Legos in the lab. And I called my presentation Rebuilding Cancer to Tear It Apart. First of all, I'd like you to meet Ragnhild. Ragnhild is 65. She works here at St. Olav, the hospital. She's a secretary. Probably saw her if you went for an appointment. She has quite a large family, husband, kids, even grandkids now, planning to retire soon. Who knows, maybe Gran Canaria. The problem we have is that Ragnhild has been feeling a bit sick recently, a lot of stomach pain, no appetite, and overall a bit dizzy, not great. She goes to her forslege, her GP, her doctor, and tells them about it. And the doctor says, probably just a stomach bug, don't worry about it, it's gonna disappear, just wait it out. The problem is that this is how Ragnhild's belly starts to look like. That's not good. She goes back to her GP, nags him, nags him, nags him. 3 months later, she finally gets a scan at St. Olav. This is what you see on the scan. The big gray blobs. You're supposed to see organs. And this is what is happening inside Ragnhild's body. Normally, the tissue would be flat, and here what you see is liquid that is accumulating in her belly because something is making her vessels permeable. Ragnhild has ovarian cancer. It is at stage 3, which means the cancer has started spreading, and this is why her belly looks like this. And the clock is ticking, because ovarian cancer is often caught at this stage, stage 3, but if it keeps going at stage 4, here you have the survival rates. Stage 3, 41%, stage 4, 20%. Clock is ticking, and we have to do something very quick for her. She has several treatment options. Surgery. The surgeon will remove most of the metastatic tissue, the cancer that has started spreading, and the tumor. Then some chemotherapy, which is a very effective but very aggressive treatment with a lot of side effects, very difficult to handle for the patients. And something that has been gaining a bit of popularity recently, what is called targeted therapy, which means that instead of being a nuclear bomb, the treatment will focus on one specific target or protein to inhibit the cancer growth and eventually kill it. But she has another option, even newer, which is called personalized therapy. It means that the treatment that Ragnhild would receive is fully adapted to the specificities of her cancers. The surgeon asks her if she would like to be part of a clinical trial that's happening at St. Olav right now about this. It's a difficult choice because she might not necessarily get benefits from that trial, but maybe future patients will. And this is an artistic vision of what I do. I will try to help Ragnhild by rebuilding her cancer in the lab and figuring out which treatment works the best on it. Ragnhild takes a bit of time, but finally she agrees to it. This trial has multiple goals. This is what the oncologist, the doctor, is interested in. He wants to know which treatment he has to give to Ragnhild to make sure the cancer gets away and does not come back. And this is why I, as a researcher, I'm interested in. I want to understand what's happening around the tumor. How can it become so invasive? How can it spread that fast and cause that many damages? So that's a lot of dual goals. And it's a win-win for the surgeon and for me. So probably a lot of you already had dinner or are gonna get dinner. So I made some time-friendly pictures, not including stuff. Contact me if you want the pictures that are not friendly. During the surgery, the tumor is removed, and here I come at Kvinnebarn, the Center for Gynecological Medicine, when they call me, hey, come pick up the samples. I get the samples, and then I run back to my lab. And using some enzymes, I can break apart the tumor and reconstitute it again, exactly like a Lego, in some plates in the lab. And then I can grow that cancer and then try out which medication might work or not. These 3D tumors are called organoids, or tumors in a petri dish. Over time, they grow more and more cancer cells because the original tumor has cancer cells, but it also has a lot of other cells like immune cells, support cells. But what I want to know is which treatment works on cancer. Each gray blob you have here is an organoid, is a tumor in a petri dish. I do a lot of imaging to track how this is growing, and I can also do something called immunofluorescence imaging that you see with the very nice colors here. And I have a lot of markers to tell me what is cancer and what is not, which are here in the different colors. Here is at a bigger zoom. I think it's a very pretty picture. I really like it. And here you have the skeleton of the cells and some other markers to tell me in purple and in red, this is cancer. So now that I know for sure that what I have are cancer cells, I can do a drug screening. So this is a bit technical, but I will take these organoids and using a robot, test a lot and a lot, hundreds sometimes, of medications, of drugs on them, and then see which medication make them die faster and also impact the method that they die. And then I can report to the surgeon, this and this medication works, this one, maybe leave it apart for now. This is an example of how I would report. At the top you have carboplatin, which is a chemotherapy, so very aggressive treatment, but very difficult for the patient. You can see that it's a treatment that the tumor is sensitive to. Quite sensitive, medium sensitivity, and the invasion of the tumor is halted. This is very important, because if the tumor keeps spreading, then we cannot do surgery anymore. It's palliative treatment. But here, you see that medication, olaparib, which is a new medication, and the tumor is sensitive, very sensitive to this treatment, and the invasion is halted. And lucky for us, this treatment is less aggressive than carboplatin. So I can tell the surgeon, okay, give it a try maybe. And based on my research, this treatment is the best for the patient. Ragnhild has got the breast treatment as fast as possible, and she fought very bravely. So now she's in remission. That's great news. But the problem is that her journey is not finished. Getting cancer took a huge toll on her mental health, and she would need psychological help. She would need a lot of follow-up by the doctors to make sure the cancer is not coming back. And she was 65. She was so close to retirement, but probably she's never going to come back to work. So social security also have to play a part here, as well as the other healthcare practitioners, such as nurses and physical therapists, that will help her in her recovery process. Although I talked here about ovarian cancer, this is a method that can be applied to other types of cancer. And I would like you here, and Ragnhild also would like you, to meet Sven. This is one of her husband's friends. He's 72, already retired, good for him. But he just got diagnosed with prostate cancer. And since Ragnhild's trial has been really successful, we can hope to help Sven as well and make those organoids. This is the next step of our adventure here. Yeah, I'd like to thank you for being here.